The Royal Commission, we all have such great hopes for the Royal Commission. I would just love to see a system that isn't under so much pressure and that has resources that allows staff to be able to work in a slower way, and to certainly family inclusive practice where clinical staff, community staff, everybody works as a team around the person with the mental illness.
If you've ever been in a SECU, people are existing, they're not living. We talk about penalising people, and really that's what it is. There's got to be a better way.
Their family, if they're still intact, are asked to hold them and jump through hoops, get them to assessments and support them in between managing their mental health, in between managing their drug and alcohol and any violence that might come from the drug and alcohol, and all from their consumers' frustration. So the family are asked to hold, or it's assumed the family can hold. We've been turned away from ED departments after an overdose of psychiatric medication together with drugs, turned away and said, come back and see us tomorrow and mental health will do an assessment. And it was just assumed that I could hold my son.
I'd like to see peer support encouraged and promoted and expanded, not just in clinical services but also in community services. There's a saying that I have which is, who's your family? And that just takes in everybody. It takes in your best friend, it takes in your sister, your brother, your auntie, your uncle. And that may come from the fact that I come from Aotearoa, and whānau or family is huge, and it extends to anyone who does this, who believes in the same kinds of things that I believe in. So that's what brought me here today, because who's your family? I think it's important, and I think Tandem does it well.
It would be really beneficial if they could give us very practical ideas on even how to answer some of the questions or how to communicate with our sick person. I can remember the very daunting feeling I had every time my son would walk into the kitchen when he got out of bed, how to actually talk to him, because he'd changed so much. It sometimes felt as if he was a totally different person.
Children particularly are just very confused about what's happening when there's somebody in their family that is unwell, but they don't really know much more than people saying, oh, they're not well. And so it's be really helpful for them to be getting a lot more support. We can support children by talking to them, listening to them, asking them, letting them know some basic information, answering questions, letting them know they're not alone, that there's lots of people in this situation, there's lots of people that are helping. Of course, we're all part of families in different variations, whether we've created our family or through friends or biology, and it's just who we are.
There are a number of people working within the service very hard to make sure that we do better actually in how we connect with carers and families. Generally we can do better by actually listening clearly to people thinking that they actually have a really valid contribution to make, that they are the person who knows the client better than we do. They have usually known them for years. They are the person who will continue to know the client afterwards. They will continue to care when we have finished our part in their life. And so listening very carefully to those people, taking on board some of their suggestions, listening to their ideas, treating them to some extent as equals in, whilst different roles, but equals in a partnership to care, listening, supporting and understanding and accepting the validity of people's stories is really, really important. The service is very definitely very reactive. It's driven by a need to put out fires all over the place, and we need to be far, far better at actually journeying with people, at actually getting in early when people need the health support. And I hope the Royal Commission both sees the need for funding and resources into that, but also how we use that funding and resourcing to actually get in early enough that people don't need the acute beds at the level that they currently do, that presentations to ED go down because people are actually getting the support and the help they need before they get to crisis point, and that's really what the service needs to achieve for sure.
Just following the process of the Commission, the thing that I was most moved by was some of the testimony of some of the carers that came and presented. And, I watched day after day of the things that they were saying and the things that were broken in the system, and every single thing that people said, I thought, yep, that's right, I see that every day in my work. And I think what struck me is how long people have to wait after they ask for help to actually get help. So I was really moved by the carers that described, trying to get help for their loved one for months, even years, before something terrible happened, and it wasn't until, the person hit rock bottom, or they committed a crime, or they, God forbid, they killed themselves before they got any sort of help. And sometimes when they did finally get some help, it was very short, so it was a very short admission to hospital, or it was a very brief interaction with the emergency department or the community mental health service. And I think that sometimes people get pushed through so fast and they don't necessarily have the time or the help that they need. So what I would like to see is that carers and families know exactly where to go and get help, and they don't have to make a million different phone calls, and that they get that help early and when they ask for it, when before anything goes wrong, and then once they are accessing the help they need, that there's no rush, that they can remain in contact with a service or a program for as long as they feel they need to. We've got some fantastic carer support roles. We've got carer consultants, we've got carer peer support workers, we've got the FATMI program, but they're so limited, and I don't think it's something that the majority of carers are able to access. So I would like to see positions like that expanded, so that there's a lot more support for people.
Carer Support Fund is so well used in our service. It really does help carers enormously, and it's quite a vital part of offering families support. Carers are always helping the person with the illness out financially. They're always putting their hand in their pocket. So, and the Carer Support Fund is just a way of validating that they actually have a role, and that their role is valued.
I know that Tandem assists people all the time with the Carer Support Fund, and there's probably more people than there are funds. So that's a very difficult position to be in when allocating those funds. There are many families who struggle, and there's not enough places for them to go.
I did access the Tandem carer support, and that was really useful. We've supported families when there was a lot of stresses around financial issues, so basic things like groceries and bills, but we were also able to use the funding in supporting one of our clients. He had quite a lot of issues, I guess, from growing up with his family, and then quite a lot of aggression towards his mum, but his mum was trying to do her best and support him, so we also supported her using the Tandem Carers Fund to access psychology sessions and support in funding that, so she found that really, really useful as well in supporting him.
In our job we feel like we need to fix things for people when in fact, you know, the value of our role can sometimes just be sitting in the space with the person. You scratch the surface and underneath so many of us are injured and hurt and crying and calling out for more, and to be able to have a job where a manager treats me with compassion and values my input as a carer and can respond with such empathy is really important. We think that our job as humans is to avoid pain. Our job as parents is to protect our children from pain, and our job as friends is to fix each other's pain. Maybe that's why we all feel like failures so often, because we all have the wrong job description of love. People who are hurting don't need avoiders, protectors or fixers. What we need are patient, loving witnesses. People who sit quietly and hold space for us. People to stand in the helpless vigil to our pain.